So my name is Dilika. I am a gastroenterology specialty doctor from the Royal Glamorgan Hospital. Thank you for taking the time to listen to this and view our poster. The poster is titled Differences in Endoscopy Training in Wales, Implications in the Shape of Training Era. Now, implementing Shape of Training report has the effect of reducing gastroenterology specialty training from 5 years to 4 years. A number of authors have highlighted the problems in the current 5-year training of trainees achieving full JAG certification in colonoscopy and accessing training to achieve competency in GI hemostasis, given the need for an out-of-hours bleeding routers. In Wales, trainees are not distributed evenly across hospital sites, and this leads to variable access to training lists. In hospitals where there are an increased number of medical, surgical, and clinical endoscopists, there is increased challenges to provide each trainee with a weekly training list. JAG recommends a minimum of 20 formal training lists per year, but ideally trainees require 1 training list per week. Clinical endoscopists are on accelerated training programs requiring 2 lists per week. Our data indicates some health boards provide a more upper GI focus to training, whilst others provide more lower GI procedures, and this may reflect the year and stage of trainees in their respective placements. Within both upper GI and lower GI pre-certification training rates, there is a twofold difference between hospitals. In one hospital, a lower GI endoscopy fellow was appointed specific comparison of their quarterly procedure progress rates show this is significantly higher than is achieved by registrars and ST posts. This provides evidence of the scale of the challenge for endoscopy training in the Shape of Training era, as none of the 6 health boards are currently providing training opportunities at the rates that would be required to achieve dual accreditation in upper GI and lower GI endoscopy in 4 years. This necessitates the training community to look at models for training delivery that will support our endoscopists of the future and can augment the current rates of progression of training to allow certification in diagnostic modalities and core therapies within the time allowed for specialty training. Thank you very much for listening to this.